Have you ever noticed how the most dangerous health problems rarely announce themselves with dramatic symptoms? A heart attack may come with crushing chest pain. A broken bone demands your attention immediately. But the kidneys are different. The kidneys are patient, quiet, almost secretive. They can lose a significant amount of function before the average person realizes anything is wrong. That is what makes kidney disease so dangerous after the age of 70. Not because it is rare, because it is often silent. Many older adults assume that if their kidneys were struggling, they would know it immediately. They imagine severe pain, obvious illness, or some unmistakable warning sign that forces them into action. Unfortunately, that is not how the kidneys usually work. In fact, one of the most troubling realities in medicine is that many people discover a kidney problem only after substantial damage has already occurred. And when they look back, they realize the body had been trying to communicate with them for months, sometimes years. The signals were there. They simply didn't recognize them. That is why today's discussion matters. Because the sooner you recognize these subtle warning signs, the sooner you can speak with your healthcare provider, investigate what is happening, and potentially slow further decline. What makes this especially important after 70 is that the kidneys naturally change with age. Blood flow decreases. Filtering efficiency gradually declines. The body's ability to recover from stress becomes less resilient. That doesn't mean kidney failure is inevitable, far from it. But it does mean that paying attention becomes more important than ever. Today I want to walk you through 5 silent signs that many older adults ignore until they become impossible to overlook. And I encourage you to stay until the end because the number one sign is often dismissed as a normal part of aging when it can actually be one of the earliest clues. Before we begin, tell me your age and where you're watching from in the comments below. I always enjoy seeing how many people from around the world are part of this community. Now let's begin with sign number 5. Sign number 5. Changes in appetite that seem to come out of nowhere. Most people don't immediately associate appetite with kidney health. They think about digestion. They think about the stomach. They think about taste preferences. Very few people think about the kidneys. But the kidneys play a critical role in filtering waste products from the bloodstream. When that filtering process becomes less efficient, substances that should normally leave the body can begin accumulating. And one of the earliest ways this may affect a person is through appetite. Food may seem less appealing. Favorite meals may lose some of their enjoyment. A person may begin eating smaller portions without consciously trying to do so. Sometimes there is even a subtle metallic taste in the mouth. Other times, people simply describe feeling off around food. The challenge is that appetite changes are incredibly easy to dismiss. Many older adults assume they are simply eating less because they are aging. And while appetite can naturally change with age, a sudden or persistent reduction deserves attention. Think of your kidneys as a filtration plant working 24 hours a day. When the filtration system begins slowing down, waste does not disappear. It remains in circulation longer than it should, and the body responds in subtle ways. This is why unexplained appetite loss should never be ignored, especially alongside other symptoms. Now let's move to sign number 4. Sign number 4, persistent puffiness or swelling. This is one of those signs that many people notice but rarely connect to the kidneys. Perhaps your socks leave deeper marks around your ankles than they used to. Maybe your shoes feel tighter in the evening. Perhaps your fingers seem slightly swollen when you wake up. At first glance, this might not seem alarming. Many people assume it is simply part of getting older, but the kidneys play a major role in regulating fluid balance throughout the body. Healthy kidneys control how much fluid remains and how much leaves through urine. When kidney function begins declining, that balance can become disrupted. The body may start retaining more fluid than it should, and that excess fluid has to go somewhere. Often it settles in the ankles, feet, lower legs, or hands. What makes this sign particularly deceptive is that it often develops gradually. You don't wake up one morning dramatically swollen. Instead, it happens little by little, week after week, month after month. The body adapts. You adapt. And because the change occurs slowly, it becomes easy to normalize. This is one reason kidney disease can remain hidden for so long. The symptoms often arrive quietly enough that they blend into everyday life. And yet swelling is the body's way of telling you something is wrong. But when puffiness becomes a regular pattern rather than an occasional event, it deserves investigation. Because your kidneys may be trying to tell you something important. But when puffiness becomes a regular pattern rather than an occasional event, it deserves investigation. Because your kidneys may be trying to tell you something important. Sign number 3, feeling unusually tired even when you think you've had enough rest. Most people assume fatigue belongs to aging. After all, the body changes over time. Energy levels shift, recovery takes longer, and many older adults simply accept tiredness as part of growing older. But there is an important distinction between normal aging and persistent fatigue that seems disproportionate to your activity level. The kidneys do much more than filter waste. One of their lesser-known responsibilities is helping regulate the production of red blood cells through a hormone called erythropoietin. Think of red blood cells as the body's delivery trucks. Their job is to transport oxygen to every tissue and organ. When kidney function begins declining, the production of this hormone may decrease. As a result, fewer delivery trucks are available to transport oxygen where it is needed. The destination remains the same. The workload remains the same. But fewer vehicles are making the trip. Over time, the body begins noticing the difference. You may feel exhausted after activities that once felt easy. Simple chores become surprisingly draining. A short walk requires more effort. Even mental tasks may feel more demanding. Some people describe it as walking through water. Others say they feel as though their batteries never fully recharge. What makes this symptom so deceptive is that fatigue has countless possible causes: poor sleep, stress, medication side effects, heart conditions, nutritional deficiencies. The list goes on. Which is why fatigue alone does not diagnose kidney disease. But when persistent fatigue appears alongside other warning signs, it becomes part of a larger picture, and that picture deserves attention. The body rarely sends just one signal. It usually sends several. The challenge is learning how to recognize the pattern before the message becomes impossible to ignore. That brings us to sign number 2, and this is one of the most overlooked warning signs of all. Sign number 2, changes in urination, especially during the night. If you've reached your 70s, chances are you've gotten up at least once during the night to use the bathroom. For many people, that becomes more common with age. But there is a difference between occasional nighttime urination and a noticeable change in your normal pattern. The kidneys are responsible for filtering blood and producing urine. In many ways, urine is one of the clearest windows into kidney function. When the kidneys begin struggling, Changes often appear here long before a person experiences severe symptoms. Perhaps you're getting up 2, 3, or even 4 times a night when that was never your normal routine. Maybe the volume of urine seems different. Perhaps the urine appears unusually foamy. Maybe the color changes more frequently than before. These details may seem minor, but they matter. Imagine a water treatment facility responsible for processing thousands of gallons every day. If the machinery begins malfunctioning, one of the first places you'll notice the problem is in the output. The same principle applies to the kidneys. Urine provides clues about what is happening behind the scenes. One particular sign that deserves attention is persistently foamy urine. Occasional foam is normal, but when urine repeatedly appears unusually foamy, it may indicate excess protein leaking through the kidney's filtration system. Healthy kidneys are remarkably selective. They keep important substances inside the bloodstream while allowing waste products to leave. When that filtering system becomes damaged, proteins that should remain in circulation can begin escaping, and sometimes the first visible clue is foam. Another important change is increased nighttime urination. Many people assume this is simply a bladder issue. Sometimes it is. But sometimes the kidneys are no longer regulating fluid the way they once did. As a result, more fluid is processed during the night, forcing repeated trips to the bathroom. Unfortunately, interrupted sleep creates another problem. Poor sleep increases fatigue. Fatigue reduces physical activity. Reduced activity affects overall health. And before long, multiple symptoms begin feeding into one another. This is one reason kidney disease can be so difficult to recognize early. The symptoms rarely arrive as dramatic emergencies. Instead, they arrive as subtle inconveniences. A little more tiredness, a little more swelling, a few more trips to the bathroom. Each change seems small by itself. Together, they tell a very different story. And this is where I want to pause for a moment and say something important. Many people become frightened when they hear discussions like this. They immediately begin wondering whether every symptom means kidney failure. Please don't make that mistake. The purpose of this video is not to create fear. It is to create awareness. Many of the symptoms we've discussed can occur for reasons completely unrelated to kidney disease. The goal is not self-diagnosis. The goal is recognizing when a conversation with your healthcare provider may be appropriate. Because the earlier a problem is identified, the more options often exist for addressing it. And that brings us to the most important sign of all, the one that many older adults dismiss for months or even years because it seems unrelated to the kidneys. And yet it may be one of the earliest clues that something important is changing inside the body. Sign number 1, persistent itching that seems to have no obvious explanation. This surprises many people. When most individuals think about kidney problems, they imagine changes in urination, swelling, or fatigue. Very few people think about the skin, and yet the skin is often where the body quietly reveals that something deeper may be happening. Healthy kidneys continuously remove waste products and help maintain a delicate balance of minerals and nutrients throughout the bloodstream. When kidney function begins declining, that balance can become disrupted. Over time, waste products may accumulate. Mineral levels may shift. The body begins responding in subtle ways. One of those ways can be persistent itching, not the occasional itch everyone experiences, not a mosquito bite, not dry winter skin, but an ongoing itch that seems difficult to explain and difficult to relieve. Sometimes it affects the arms, sometimes the back, sometimes multiple areas at once. Many people spend months treating the symptom without ever asking why it appeared in the first place. Creams are applied, lotions are changed, detergents are blamed. And while skin conditions certainly exist, persistent unexplained itching deserves attention because it may be one of the body's earliest warning signals. What makes this sign particularly challenging is that it doesn't feel connected to the kidneys. The connection appears invisible, yet the body functions as an integrated system. When one major organ struggles, other systems often begin revealing clues. And that brings us to perhaps the most important lesson in today's discussion. None of these signs by themselves prove kidney disease. Fatigue alone doesn't prove it. Swelling alone doesn't prove it. Changes in urination alone don't prove it. Appetite changes alone don't prove it. Itching alone doesn't prove it. The real value comes from recognizing patterns. Medicine often works like a puzzle. One piece rarely tells the entire story, but when several pieces begin fitting together, the picture becomes clearer. That is why awareness matters. Not fear, awareness. Because awareness leads to action, and action creates options. One thing I want to emphasize before we finish is that this conversation is not new. Doctors, kidney specialists, researchers, and health educators have been talking about kidney health for years. I am certainly not the first person to discuss these warning signs. What concerns me is that many people still hear about them only after a problem has already progressed. That is why I continue having this conversation. Not because the information is new, because the information remains important, and because someone watching today may recognize a pattern. The kidneys are remarkable organs. Day after day, year after year, they work quietly in the background, filtering blood, balancing fluids, regulating important functions that most of us never think about. They ask for very little attention until something begins going wrong. And when that happens, the earliest warnings are often easy to dismiss. A little swelling, a little fatigue, a little itching, a few extra trips to the bathroom, a reduced appetite. Each symptom seems small. Each symptom seems manageable. Each symptom seems easy to explain away, but together they can tell a very different story. That is why paying attention matters. Not becoming anxious, not assuming the worst, simply paying attention. Listening to what the body may be trying to communicate. Because the earlier concerns are identified, the greater the opportunity to investigate, understand, and respond appropriately. If there is one message I hope you take away from today's video, it is this. Do not ignore persistent changes, simply because they arrive quietly. Some of the most important health conditions begin with whispers, not alarms. And kidney disease is often one of them. If you found this discussion helpful, let me know in the comments which of these 5 signs surprised you the most. I also encourage you to share your age and where you're watching from. Our community includes viewers from all over the world, and I always enjoy seeing how far these conversations reach. And if you know someone over 70 who might benefit from learning these warning signs, consider sharing this video with them. You never know when a simple piece of information might encourage someone to ask an important question or schedule an important conversation with their healthcare provider. Thank you for spending this time with me today. Take care of your kidneys, take care of your health, and most importantly, continue paying attention to the signals your body gives you. Sometimes they are telling you far more than you realize.